think health reform will be considered a tipping point because the conversation that led to health reform, I think, generated a transparency of cost of data. It actually started to engage every different part of the healthcare sector, whether you were the physician, the healthcare provider, the lab, the technology company. So I think we'll look back and see that really was the tipping point. I think the tipping point for consumers happened just a few years ago with the Terri Schiavo case. You might recall that Terri Schiavo was the patient that the nation focused on, and should she be allowed to die? She was in a vegetative state, and people, I think, for the first time weighed in over the dinner table. They weighed in within the community. What is health? What health care should be provided? I think we will look back and say that was the time that the consumer started to really think about what kind of health care they wanted and what they expected. And certainly politically, it didn't turn out the way people thought it was going to. So I think that consumer tipping point happened, I think, emotionally with that case, but I think the technology of transparency of information, of the consumer saying, I want to be in charge, also drove that tipping point. I think actually health reform caught up to it in terms of payments, when those who were most affected by the payments, the federal government, the employers, saw this level of cost increase and saw the transparency of cost, and I think started to have a new and different type of engagement.